Where did COVID-19 come from? This question has puzzled scientists, governments, and the public. Understanding the origins is crucial to prevent future outbreaks. The origins remain a subject of intense debate. Various theories have been proposed, from Wuhan's wet markets to high-security labs, and even suggestions of a U.S. origin. The story is complex. The WHO and experts are tracing the virus's path. Despite efforts, a definitive answer is elusive. COVID-19 is believed to have originated in a wet market in Wuhan, China. Wet markets sell live animals in close quarters, allowing viruses to jump to humans. The virus likely jumped from a wild animal, possibly a bat, to humans. In December 2019, cases of unknown pneumonia were reported in Wuhan. Investigations linked these cases to the Wuhan seafood wholesale market. Samples from the market showed traces of the virus. Experts found SARS-CoV-2 shares similarities with bat coronaviruses. Another theory that has garnered attention is the lab leak hypothesis. This theory posits that the virus accidentally escaped from the Wuhan Institute of Virology, a facility known for studying coronaviruses. Proponents of this theory point to the proximity of the institute to the initial outbreak site and the nature of the research conducted there. In 2021, a report commissioned by the U.S. Department of State suggested that several researchers at the WIV fell ill with symptoms consistent with COVID-19 in late 2019. This revelation fueled speculation about a potential lab accident. However, definitive proof remains elusive. The lab leak theory has sparked significant political and scientific debate. Some scientists argue that the possibility of a lab accident cannot be entirely ruled out. Others emphasize the lack of concrete evidence and warn against speculative conclusions without solid proof. The investigation into the lab leak theory has been hindered by limited access to data and samples from China. International efforts to probe this possibility continue, but the challenges of transparency and cooperation remain significant hurdles. Amidst the various theories, there is the controversial claim that COVID-19 could have originated in the United States. This hypothesis emerged due to statements from Chinese officials suggesting the virus might have circulated outside China before Wuhan. Proponents point to unexplained respiratory illnesses in the U.S. in late 2019. However, this hypothesis lacks substantial scientific backing. Most experts agree the genetic evidence points to a zoonotic origin in China. Section 5. Natural spillover and evolutionary explanation. Beyond the more sensational theories, many scientists advocate for a simpler explanation: natural spillover. This theory posits that the virus naturally jumped from animals to humans without any human intervention or laboratory mishaps. It aligns with what we know about previous pandemics, such as the 2002 to 2003 SARS outbreak. Coronaviruses are known to reside in bats and can spill over to other species, including humans. The process involves the virus evolving and adapting to new hosts. This natural spillover is facilitated by environmental factors, human encroachment on wildlife habitats, and the wildlife trade. Genomic studies of SARS-CoV-2 have revealed its close relationship with bat coronaviruses. These findings support the natural spillover theory. While the exact pathway remains unclear, the evidence suggests that it likely involved one or more intermediate species. The natural spillover theory underscores the importance of monitoring wildlife diseases and the interactions between humans and animals. It calls for better surveillance systems to detect and respond to potential zoonotic threats before they become pandemics. Section 6. The role of wildlife trade. Wildlife trade concerns public health experts. Wet markets are hotspots for disease transmission. Different species in poor conditions allow viruses to jump to humans. Wuhan market, linked to COVID-19, had various wild animals. Crowded, unsanitary conditions likely facilitated the spillover event. Global regulation of wildlife trade is inconsistent. Demand for exotic animals drives a black market. This trade risks biodiversity and global health. Stricter regulations and public awareness are needed. Expert insights. What do scientists say? Scientists worldwide have been investigating COVID-19's origins. Many experts believe zoonotic spillover is the most plausible explanation. Dr. Peter Ben-Mbarek led a team to Wuhan in 2021. They concluded the virus likely originated in bats. No conclusive evidence supports the lab leak theory. Research suggests SARS-CoV-2 is a product of natural evolution. The search for COVID-19's origins is not just a scientific endeavor, it's also a highly politicized issue. The geopolitical implications have fueled tensions between major world powers, particularly the United States and China. Each side has accused the other of obfuscation and misinformation. China has faced criticism for its initial handling of the outbreak and perceived lack of transparency. In response, Chinese officials have suggested alternative theories, including the virus's possible origin outside China. These claims have been met with skepticism by the international scientific community. The United States has also been embroiled in the controversy. The lab leak theory gained traction, partly due to statements from U.S. officials and intelligence reports. This has led to calls for more rigorous investigations and greater accountability from all parties involved. The politicization of the pandemic's origins complicates efforts to find the truth. It highlights the need for international cooperation, unbiased scientific inquiry, and the depoliticization of public health issues to effectively address and prevent future pandemics. The COVID-19 pandemic has underscored the critical importance of global health security. Understanding the origins of the virus is just one piece of the puzzle. The broader goal is to strengthen systems to detect, prevent, and respond to future infectious disease threats. One key lesson is the need for robust surveillance systems. Early detection of unusual disease patterns can help contain outbreaks before they become pandemics. This requires investment in public health infrastructure, laboratory capacity, and data sharing. International cooperation is another essential component. The pandemic has shown that diseases do not respect borders. Collaborative efforts such as the WHO's Global Outbreak Alert and Response Network (GORN) are vital for a coordinated response to global health emergencies. Finally, the pandemic has highlighted the importance of science-based decision-making. Public health policies should be guided by evidence and expert advice. This approach ensures effective and efficient responses to health crises, ultimately saving lives and reducing the impact on societies and economies. Moving forward, it is imperative to strengthen surveillance and research efforts to better understand and prevent pandemics. Enhanced surveillance systems can provide early warnings of potential outbreaks, allowing for swift action to contain them. Investing in research is crucial. Studies on viral evolution, transmission dynamics, and animal reservoirs can provide valuable insights. Collaborative research initiatives involving scientists from around the world can accelerate discoveries and innovations. Public health preparedness must also be improved. This includes training healthcare workers, stockpiling essential supplies, and developing rapid response protocols. Equipping healthcare systems to handle surges in cases is vital for mitigating the impact of future pandemics. Lastly, fostering public awareness and education is essential. Educating communities about the risks of zoonotic diseases and promoting healthy practices can reduce the likelihood of spillover events. Public engagement and transparency are key to building trust and ensuring compliance with public health measures. In conclusion, uncovering the origins of COVID-19 is a complex and ongoing endeavor. Various theories have been proposed, from the wet market hypothesis to the lab leak theory, and the controversial claim of a U.S. origin. While the exact source remains uncertain, the scientific consensus leans towards a natural spillover. Understanding the origins of COVID-19 is not just about solving a mystery, it is about learning from the past to protect the future. The lessons from this pandemic emphasize the need for robust surveillance, international cooperation, and science-based decision-making. As we continue to investigate and debate the origins of COVID-19, the importance of global health security cannot be overstated. Strengthening our systems, investing in research, and fostering public awareness are crucial steps to prevent future pandemics. The world must come together to ensure that we are better prepared for the next health crisis. Only through collective effort and a commitment to scientific inquiry can we hope to build a safer, healthier future for all.